Okay.
Okay.
Okay, sir. Thank you.
Yeah.
Mister,
Yes.
Mister, എൻ്റെ
Yes.
ഷെയർ സ്ക്രീനിലെ പ്രസന്റിങ്ങില് വിൻഡോ കൊടുത്താൽ മതി.
ഞാനിപ്പോ ചെയ്യുന്ന രീതിയിലാണ് ഞാൻ ചെയ്യാൻ പോണത്. ഇതുവരെ ചെയ്തിട്ടുള്ള ഒരു സ്റ്റൈൽ ഉണ്ട് എനിക്ക്. ആ രീതിയിൽ തന്നെ ഞാൻ ചെയ്ത് പൊക്കോളാം.
ഓക്കെ, ശരി.
എനിക്ക് തോന്നുന്നില്ല കുഴപ്പമൊന്നും വരുന്നുണ്ട്.
ഓക്കെ, ശരി.
ഇത് നമ്മുടെ 12ാമത്തെ വെബിനാറാണ്. ഓക്കെ, മൈ 12th വെബിനാർ.
Good afternoon, Esther.
Good afternoon and welcome to the 5th session of the National Webinar Series, KEIZAI 2020. Well, I am pleased to introduce our Honorable Resource Person, Dr. Molly Kurula, the Founding Director and Professor at the Center for Women's Studies, University of Calicut. Madam contributes immensely to the empowerment of women in many spheres of public life at various levels. She is actively involved in various gender sensitization programs. She is a member of PhD Assessment Committee of several Indian and foreign universities and the like. Now, on behalf of MES Ponnani College and KEIZAI team, a warm welcome you, ma'am. Next, I would like to welcome our vibrant secretary, Rashid sir, to this webinar. Now, I take this opportunity to welcome our principal, Dr. Subeh sir, to this session. Next, I would like to welcome our beloved HOD, Madam Bushra, and my colleagues and all the distinguished invitees and participants and my dear students to this session. Once again, I welcome you all for taking time out and being here today. Thank you. Now, I invite our Honorable Secretary, Rashid sir, for felicitation.
Hello. കേൾക്കുന്നില്ലേ?
Yes, sir. കേൾക്കുന്നുണ്ട്, sir.
കേൾക്കുന്നുണ്ടല്ലോ. Okay. Thank you, Emily. Thank you. First of all, I would like to thank you all for inviting me this function, this webinar. This is the first time I am speaking in a webinar. I have participated in a webinar, but this is the first time I am speaking in a webinar. അതുകൊണ്ട് തന്നെ അതിൻ്റെതായിട്ടുള്ള ഒരു എന്താ പറയാ, പറയുന്ന എന്താണ് പറയേണ്ടതെന്നുള്ള ഒരു ആകാംക്ഷ, എങ്ങനെയാണ് അതിൽ നമ്മൾ ഡെലിവറി ചെയ്യുക എന്നുള്ളൊരു സങ്കോചമൊക്കെ ഉണ്ടാവും മനസ്സിൽ. അതെന്തെങ്കിലും അത് സാധാരണ നിങ്ങൾ ക്ഷമിക്കുമെന്ന് വിചാരിക്കുന്നു. കെസായ്, ഈ പരിപാടിയുടെ പേര് ഞാൻ ചോദിച്ചു, ബുഷ്രയോട് ചോദിച്ചപ്പോൾ എന്താണ് ഇതിന്റെ അർത്ഥം എന്ന് വെച്ചാൽ ഇതൊരു ഫ്രഞ്ച് വേർഡാണ്. ഇത് എക്കണോമിക്സിന് ഫ്രഞ്ചിൽ പറയുന്ന ഒരു വാക്ക് എന്നാണ് എന്നോട് പറഞ്ഞത്. നമ്മുടെ കോളേജിലെ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റിനെ കുറിച്ച് പറയുകയാണെന്നുണ്ടെങ്കിൽ തികച്ചും ഞാൻ കോളേജിൽ മാനേജിംഗ് കമ്മിറ്റി മെമ്പർ ആയ അന്ന് മുതൽക്ക് തന്നെ എല്ലാ ഡിപ്പാർട്ട്മെന്റുകളെ കുറിച്ചിട്ടും ശ്രദ്ധിക്കുമ്പോൾ അതിൽ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റ് അവരുടെ വ്യത്യസ്തമായ രീതിയിൽ പരിപാടികൾ സംഘടിപ്പിക്കുന്നതും അത് വിജയത്തിലെത്തിക്കുന്നതിനും മൊത്തം ഡിപ്പാർട്ട്മെന്റ് കാണിക്കുന്ന ഉത്സാഹം എന്നെ എപ്പോഴും അത്ഭുതപ്പെടുത്താറുണ്ട്. ഉദാഹരണത്തിന് 2-3 വർഷങ്ങൾക്ക് മുമ്പ് നടന്ന ഒരു സ്വാശ്രയ എന്നുള്ളൊരു പരിപാടി, അതും ഇന്നത്തെ വിഷയത്തോട് യോജിക്കുന്ന രീതിയിൽ അവിടുത്തെ പൊന്നാനി മുനിസിപ്പാലിറ്റിയിലുള്ള സ്ത്രീകളെ പങ്കെടുപ്പിച്ചുകൊണ്ടിട്ടുള്ള ഒരു പരിപാടിയായിരുന്നു. അവിടെ ഒരു വ്യത്യസ്തമായ പരിപാടികൾ ഉണ്ടായിരുന്നു. കുക്കറി ഉണ്ടായിരുന്നു, ഫാഷൻ ഡിസൈനിങ്. അപ്പൊ ഞാൻ അതിനെക്കുറിച്ചിട്ട് പിന്നെ എൻ്റെ ഫീഡ്ബാക്ക് അന്വേഷിച്ചപ്പോൾ ആ പരിപാടിയിൽ പങ്കെടുത്ത പല സ്ത്രീകളും പിന്നീട് തുടർന്ന് സ്വന്തമായ രീതിയിൽ അവർക്ക് പരിപാടികൾ നടത്തിക്കൊണ്ട് പോകുന്നുണ്ട് എന്നാണ് ഞാൻ മനസ്സിലാക്കിയിട്ടുള്ളത്. അതുപോലെ തന്നെ വീണ്ടും സ്വാശ്രയയുടെ ഒരു 2ാം ഘട്ടം അതും ഇപ്പൊ നടന്നുകൊണ്ടിരിക്കുന്നുണ്ട്. നമ്മുടെ ഫിഷറീസ് മേഖലയിൽ നിന്നുള്ള പാവപ്പെട്ട നമ്മുടെ കോളേജിന്റെ ബാക്ക് സൈഡ് പടിഞ്ഞാറ് ഭാഗത്തുള്ള, അറിയാലോ അവിടുത്തെ പിന്നെ സ്ഥിതിഗതികളൊക്കെ നമുക്കറിയാലോ. അവിടെ നിന്നുള്ള സ്ത്രീകളൊക്കെ ഉൾക്കൊള്ളിച്ചുകൊണ്ട് അതും വളരെ നല്ല മികച്ച രീതിയിൽ നടത്തിക്കൊണ്ടു പോകുന്നുണ്ട്. കഴിഞ്ഞ വർഷം നിങ്ങൾ നടത്തിയ KEIZAIയുടെ ഒരു എക്സിബിഷൻ ഉണ്ടായിരുന്നു, വളരെ വിപുലമായ രീതിയിൽ കോളേജിൽ നടത്തിയ എക്സിബിഷൻ. അതും വളരെ സക്സസ്ഫുൾ ആയി. അപ്പൊ എന്തുകൊണ്ടും ഏറ്റെടുക്കുന്ന പരിപാടികൾ മികച്ച രീതിയിൽ സംഘടിപ്പിക്കുന്നതും അത് വിജയപ്രദമാക്കുന്നതിലും നിങ്ങളെ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റ് എടുക്കുന്ന ഉത്സാഹത്തിന് ആദ്യമായിട്ട് നിങ്ങളെ അഭിനന്ദിക്കുന്നു. പിന്നെ ഈ വിഷയം പൊതുവെ ബുഷ്ര നിങ്ങളുടെ HOD ഈ ഇത്തരം കാര്യങ്ങൾ ഈ സ്ത്രീകളുടെ വെൽഫെയറുമായി ബന്ധപ്പെട്ടിട്ട് പ്രത്യേകിച്ച് പൊന്നാനിയിലുള്ള അറിയാം അവിടുത്തെ ജിയോഗ്രഫിക്കലി അവിടുത്തെ സ്ത്രീകളുടെ ജീവിത സാഹചര്യങ്ങളൊക്കെ നല്ലവണ്ണം മനസ്സിലാക്കിയിട്ടുള്ള ഒരാളാണ് നമ്മുടെ HOD പ്രൊഫസർ ബുഷ്ര. അപ്പൊ അതുകൊണ്ട് തന്നെ അവര് ഈ പല എന്ത് സംഘടിപ്പിക്കുമ്പോഴും നമ്മുടെ പൊന്നാനിയിലെ അതുപോലുള്ള ഈ പാർശ്വവൽക്കരിക്കപ്പെട്ടിട്ടുള്ള ഇതുമാതിരിയുള്ള പാവപ്പെട്ട സ്ത്രീകളുടെ ഉന്നമനം ലക്ഷ്യം വെച്ചുകൊണ്ടാണ് മിക്ക പരിപാടികളും സംഘടിപ്പിക്കാറുള്ളത്. അപ്പൊ ഇന്നത്തെ എനിക്ക് തോന്നുന്നു ബുഷ്രക്ക് പറ്റിയ ഒരു അതിഥിയെ തന്നെയാണ് നിങ്ങൾ കണ്ടുപിടിച്ചിട്ട് ഇന്നിവിടെ വരുന്നത്. മോളി കുരുവിള അവരെ കുറിച്ച് പറഞ്ഞു. യൂണിവേഴ്സിറ്റിയിലെ ഈ പിന്നെ അവിടുത്തെ പ്രൊഫസറായിട്ടുള്ള മോളി കുരുവിള നിങ്ങൾ ഇന്നത്തെ അതിഥിയായിട്ട് കൊണ്ടുവരുന്നത് തീർച്ചയായിട്ടും അവരെന്താണ് പറയുന്നത് ഇതിനെ കുറിച്ച് പറയുന്നത് കേൾക്കാൻ ഉള്ള ഒരു ആകാംക്ഷയോട് കൂടിയിട്ടാണ് നമ്മൾ ഇരിക്കുന്നത്. ഇതിന്റെ ഉദ്ഘാടനം നടത്തിയത് പ്രഥമ ഈ പരിപാടിയുടെ ഉദ്ഘാടനം നിർവഹിച്ചത് നമ്മുടെ സ്റ്റേറ്റ് പ്രസിഡന്റ് ഡോക്ടർ ഫസൽ ഡോക്ടറായിരുന്നു. ആ പരിപാടി ഞാൻ വളരെ മുഴുവൻ സമയം കേട്ടിരുന്നു. അന്ന് കോവിഡിനെ കുറിച്ചിട്ടാണ് നമ്മൾ അന്നത്തെ പ്രഭാഷണം ഉണ്ടായിരുന്നത്. വളരെ മികച്ച രീതിയിൽ വളരെ സിമ്പിളായിട്ട് കാര്യങ്ങൾ അരമണിക്കൂർ നേരം നല്ല രീതിയിൽ ഒരു ക്ലാസ് എടുക്കുന്ന രീതിയിലാണ് ഡോക്ടർ അന്നത്തെ പ്രഭാഷണം ഉണ്ടായിരുന്നത്. പിന്നീട് നടന്ന എല്ലാ പരിപാടികളും വൻ വിജയമായിരുന്നു എന്നുള്ളതാണ് ഞാൻ മനസ്സിലാക്കുന്നത്. എന്തായാലും ഇന്നത്തെ ഈ പരിപാടിയിൽ ഇവിടെ വന്ന് ഇതിൽ പങ്കെടുക്കാൻ പറ്റിയതിലുള്ള ഒരു അഭിമാനവും സന്തോഷവും ഞാൻ നിങ്ങളോടൊപ്പം പങ്കുവെക്കുകയാണ്. ഇതിപ്പോ ഈ കോവിഡ് കാലഘട്ടത്തിൽ അറിയാം, നിങ്ങൾ എല്ലാവരും വീട്ടിലിരുന്നു കൊണ്ട് തന്നെ ഓൺലൈൻ ക്ലാസ്സുകൾ, കോളേജിൽ വന്നിട്ടും ഓൺലൈൻ ക്ലാസ്സുകളാണ് എടുക്കുന്ന അതിന്റെ ബുദ്ധിമുട്ടുകൾ. ഓൺലൈൻ ക്ലാസ്സുകൾ റെഗുലർ ക്ലാസ്സും രണ്ടും കൂടി കമ്പയർ ചെയ്യുമ്പോൾ നമുക്ക് തോന്നാം ഓൺലൈൻ ക്ലാസ്സുകൾ കുറച്ചുകൂടി എളുപ്പമല്ലേ. പക്ഷെ അനുഭവത്തിൽ നിന്നും മറ്റുള്ളവരുടെ അനുഭവത്തിൽ ഞാൻ മനസ്സിലാക്കുന്നത് അത് അത്ര എളുപ്പമുള്ള ഒരു കാര്യമായിട്ട് അല്ല എന്നാണ് ഞാൻ മനസ്സിലാക്കുന്നത്. മറ്റ് റെഗുലർ ക്ലാസ് എടുക്കുന്നതിനേക്കാൾ ബുദ്ധിമുട്ടുള്ള രീതിയിൽ കുട്ടികളെ കാര്യങ്ങൾ പറഞ്ഞ് മനസ്സിലാക്കുന്നതിലൊക്കെ ഉള്ള ബുദ്ധിമുട്ടുകളുണ്ട്. അപ്പൊ അത് നല്ല രീതിയിൽ നിങ്ങൾ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റ് ഫാക്കൽറ്റീസുകൾ എല്ലാവരും വളരെ എല്ലാ ഡിപ്പാർട്ട്മെന്റുകളും ചെയ്യുന്നുണ്ട്. എസ്പെഷ്യലി പിന്നെ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റ് വളരെ ലൈവായിട്ട് എല്ലാ ദിവസവും നമ്മൾ കോളേജിൽ എത്തുകയും ഫാക്കൽറ്റീസ് എത്തുകയും വളരെ കൃത്യമായിട്ട് കാര്യങ്ങൾ നടത്തുകയും ചെയ്യുന്നുണ്ട് എന്നുള്ളത് ഞാൻ മനസ്സിലാക്കുന്നുണ്ട്. അതിനുള്ള ഒരു നന്ദി കൂടി അറിയിക്കുന്നു. അതോടൊപ്പം തന്നെ നിങ്ങളുടെ ഹോൾ എക്കണോമിക്സ് ഡിപ്പാർട്ട്മെന്റ് എല്ലാ ഫാക്കൽറ്റീസിനോടും എസ്പെഷ്യലി നിങ്ങളുടെ HOD പ്രൊഫസർ ബുഷ്ര അവരെയും ഈ പരിപാടി ഇത്രയും ഭംഗിയായി ഇന്നേ വരെ നടത്തിക്കൊണ്ടു പോയ അതിൽ നല്ല രീതിയിൽ ഇതുവരെ എത്തി അതിന് നിങ്ങൾ കാണിച്ച നിങ്ങളുടെ സംഘാടകരെയും അഭിനന്ദിച്ചുകൊണ്ട് ഈ പരിപാടികൾക്ക് എല്ലാവിധ ആശംസകളും അർപ്പിക്കുന്നു. നമ്മുടെ പ്രിൻസിപ്പാൾ ലൈവിലുണ്ടെന്നാണ് എനിക്ക് തോന്നുന്നത്. പ്രിൻസിപ്പാള് ഇത്തരം കാര്യങ്ങൾ അദ്ദേഹം കാണിക്കുന്ന താല്പര്യം ഞാൻ മനസ്സിലാക്കുന്നുണ്ട്. അതുകൊണ്ട് തന്നെ അദ്ദേഹത്തെയും നന്ദി അറിയിച്ചുകൊണ്ട് എല്ലാവർക്കും ഒരിക്കൽ കൂടി ആശംസകൾ അറിയിച്ചുകൊണ്ട് എന്നെ ഈ പരിപാടിയിലേക്ക് ക്ഷണിച്ചതിനുള്ള നന്ദി കൂടി അറിയിച്ചുകൊണ്ട് ഞാൻ നിർത്തുന്നു. നന്ദി, നമസ്കാരം, ജയ് ഹിന്ദ്.
Thank you. Thank you, Rashida, for your inspiring words. Now, I would like to feel proud to welcome our chief guest, Dr. Molly Kurula, and I know she is the right person to discuss the current problem, and I invite ma'am to handle the session. Welcome.
Hi, everyone. First of all, let me appreciate and congratulate the efforts taken by MES Ponnani College, especially the Department of Economics, in organizing such a national webinar series. And definitely, I'm sure it is because of Bushra only that such a particular topic, the topic on impact of COVID-19 on women's welfare, has been included in this series. Bushra is my close friend. We have been together in gender sensitization programs. And thank you, Bushra, so much for inviting me to handle this session. And as we all know, we are passing through a very strange, a very specific phase in our lives which we had never imagined before. During the last 4 sessions, we have discussed the implications of COVID-19 on the educational sector, industrial sector, health sector, and economic sectors. I have been a participant in all the before sessions, and I think the same participants will be present in this session also. So I will try my level best not to include any repetitions of what we have discussed earlier. So in this period, it started actually as a health crisis and evolved into an economic and cultural crisis. Today, it has become a matter of policy crisis. And that is where this particular topic of implications of COVID-19 on women's welfare assumes special relevance. We know both men and women are equally susceptible virus. It does not discriminate between men or women. So much of difference is there between men and women and all the genders. It is in this context that we are starting with my presentation. You know, according to UN Women, which is the agency of United Nations, which is concerned with, entrusted with the responsibility of women empowerment and gender equality. And they say COVID-19 is the greatest setback to women empowerment and gender equality. A setback to all that we had achieved in the past. So it is not any good news that we are going to discuss now. But at the same time, I would like to make it attractive. So bad things, of course, to be not positive, of course. Make it very lively with my PPT. Screen is quite visible to all of you. The implications of COVID-19 on women is different for different groups. Women, as we know, is not a homogeneous groups or categories, depending upon whether they are belonging to the particular class, caste, employed, or not employed, have any kind of what is called disabilities. So depending upon all these categories,
Excuse me,
the
ma'am.
impact
It's not
we
audible.
have
I think
read
there is some
and we
range.
have heard women constitute 70% of the
അല്ലേ? Please wait, she will come. I think there is some problems, range problem.
Hello? Hello, Bushra? Am I audible?
Yes, ma'am.
There
Yes,
were
yes, yes.
some phone calls came in between, and whereby my connection got lost. Okay, so if at all something
Yeah,
happens,
yeah.
please ring me up. Okay,
Yes,
okay.
yes.
Yeah, so I'm going back to my slide again. So I think you might have heard what I have said about the frontline health workers. Majority of them are women. And especially among these women, there are different categories of women. Definitely the doctors, the nurses, the paramedical workforce, the sanitation workers, and in the Indian context, I was speaking about the ASHA workers and what you call all these kind of sweepers and all engaged in the hospitals. And there are also people like the nurses who are in regular contact with the COVID patients. Because in several hospitals, the doctors, they do not go in close contact with the patients. It is the nurse who reads all their what you call measurements regarding their cholesterol, their sugar, their temperature, everything is recorded by the nurses. So these nurses are in close contact with the patients than the doctors. And majority of nurses are females. In Indian context, more than 90% of the nurses are females. And these nurses, once they reach back home, they have to take care of the elderly and the children. We all know the elderly are more prone because of their decreasing immunity and the presence of other ailments, these people, they are more prone to the virus. And the women nurses or doctors, once they reach back home, they have to take care of these elderly people. In the case of men doctors, this is not so applicable. And in the beginning of the lockdown period, we have heard how the frontline workers were not having enough of the PPE equipments, personal protection equipments. And we have heard the audio record of the nurse from Delhi hospital who had to succumb to death just because they were required to use the PPE, the used PPE again and again. So once these people, they reach home, they have to take more care of the people dependent on them. So with regard to women health workers, this is a major impact which is not so common with the men health workforce. Again, there is yet another gender dimension of COVID, especially with regard to the unpaid domestic work. You know, the direct or primary impact of COVID, we have all heard in the previous sessions that men and women are equally prone to the virus, but there is more of mortality rate among men. And the reason also we have heard, women, they have more immunity, which is universally proved, scientifically proved that women have more immunity. So the mortality rate among men are more. Also, there is another reason, the addiction to cigarette smoking, drug or alcohol. It is more among men than women, and which may lead to other kind of health complications or ailments, which also contribute to the increasing mortality rate among men. So the primary impact, though it is more on men, the secondary impact of the pandemic is more on women, especially because of their gender role. The roles assigned by the society, the historically, culturally, sociologically assigned responsibility. And this responsibility include the unpaid domestic work. You know, for every work, there is payment. But for the domestic work, it is totally unpaid. And the payment, the return, is the love and affection of the family members. And if we discuss the extent of this love and affection, we don't get so much of positive feedback from the women themselves. But anyway, the women do all the household work, the mopping or cleaning, the washing, the cooking, everything. And unfortunately, this responsibility being entrusted on women, their burden has increased manifold during the lockdown period. In usual times, whatever women do is more than 4 times of that work done by men at home. But during the lockdown period, this 4 times work has increased 8 times or 10 times. We know the reason. Because when the husband, the parents and the children, they are all sheltered at home, the number of meals, the quantity of meals, everything has increased. Earlier, the husband used to take food from outside. Perhaps the lunch will be from outside. The children used to take the tiffin and go. But now, at a time when All the family members are frustrated. They frequently visit the kitchen. They want more meals, more snacks, more soft drinks. And this in turn lead to double or triple times of cleaning and washing. And you can see in this slide the work done by a housewife. And this same work will have to be done by women belonging to essential services like the health professionals, the police personnel, the local self-government members, LSG members, the bank officers, good number of them, they have to go for work after finishing all the work done at home. See, the young baby is crying after the mother with a broomstick. There the young girl is crying out, "Help me with my homework." The milkman is waiting outside, cooker is whistling, the pan is boiling, the tap is overflowing, washing machine is on. All these are happening, and these workers in the essential service, they have to finish all these and then go out for work. Here, what is the lip service done by the man of the family? He is lying down comfortably on the sofa, reading the paper with the teacup and the snacks. And he is doing the lip service, you know. What is the tragedy of gender equality in this country? He is reading out the newspaper to the wife. Instead of reading out the newspaper, if these men share the work at home, the workload would have been minimized. But unfortunately, our people are not used to this. Our men and boys are not used to sharing any household work. The maximum they do is the shopping or playing with the kids. So this is the scenario of work, household work during lockdown. And it has increased 8 times in the case of Indian women. Even if the woman is a housewife, from morning till night, she has to repeat the work. What about the unpaid care work? As I mentioned earlier, because of this sociological, cultural assignment of the care work of the aged and that of the children at home, women are struggling during COVID period. Because of the closure of schools and daycare centers, women are extremely affected. In normal times, children go to school, or children may be sent to the daycare centers. But now, all children, whether the daycare going, Anganwadi going, school going, college going, all of them are back at home. And this unpaid care work becomes extremely difficult in the case of single mothers and widows. Suppose these widows or single mothers, they belong to essential services. What will they do? Whom will they entrust the care of children? Normal times, they could take the babies to the daycare center. But now, where will they entrust the baby? So this kind of unpaid care work is not only with regard to the young babies, but also with regard to the aged parents. See, the woman, she has to take care of, even though the son is there, the daughter-in-law is culturally assigned the responsibility of taking care of the aged parents. Housewives and mothers in general, they They are working almost 24 into 7 now. As I said, more quantity and more number of meals, more cleaning, more mopping. Family members getting bored and their frustrations, they are thrown upon the mother. If the adolescent daughter or son feels frustrated, the entire frustration is thrown upon mother, not upon the father. If the father is frustrated, that is also thrown upon the mother. So the mothers serve as buffers at the home. And these mothers and housewives, they are extremely scared of the infection to family members, not about infection to themselves. In the beginning of lockdown days, I remember several of my friends and my clients, as a counselor, my clients used to call upon and say, I am having headache, having temperature. I feel I am having a cold. So they say they're all scared whether it is a kind of COVID infection. But later on, these mothers started calling me and saying, my son is having light temperature, my husband is having cold. And now I wonder, these women, they are not only scared about themselves, but they are more scared about their family members. And the lack of rest and sleep. I want to tell you a particular true story. My friend, who is a retired professor, is staying in Cochin with her parents. She is 64. Both her parents are alive. Parents means in-laws, the husband's parents. Both her sons and families, they are abroad, working abroad. But during the first week of March itself, before all the airports were closed, both the sons reached the family with the grandsons. So this friend was very happy. I'm so safe. All my children are with me. I can take care of them. But later on, what happened? The cultural frictions between the NRI children and the parents staying back in Kerala. The NRI parents and children, they wake up at 11 o'clock in the morning. They go to sleep at 1 a.m. or 2 a.m. The mother, this particular professor friend of 64 years age, she has to take care of their food, their rest, everything. She assumes that it is her sole responsibility. The parents go to bed at 9:30, have their dinner early. And this particular friend, she won't have their dinner except with the children and grandchildren. And she has to wake up early for the parents. They wake up at 6 a.m. She has to wake up, give them the bed coffee and the breakfast and everything. And she will wait for the children. Here, after recently, she called up and said, if the lockdown is not ended soon, either I will become so sick and die, or perhaps I may commit suicide because I am so exhausted. Now, the sons and their wives, they started going out because several of the malls are open, textile shops are open. They started going out, entrusting the responsibility of grandchildren to this mother. You see, we may feel this is an exceptional case. No, this is not an exceptional case. This is the case with all the retired mothers. Wherever children have come back from abroad and are in quarantine, the 64-year-old mothers struggling hard. Every other day, I get phone calls. And what the mothers say, I am tired. So I tell them, you reduce the number of meals, the number of snacks that they cannot do. You know why? Because the culture, the society expects that the mothers to provide all the people under her responsibility. Yes, that responsibility is also entrusted by the society. And they are exhausted. Another thing, during normal times, these mothers, especially housewives, they used to get some TV time while the husband and children were away. But now, there is no TV time at all, because all the TV time is taken up by the children and the husband. Nobody is interested in the soft TV programs like the serials. So they are also sad and depressed. We also need to think about the job loss, which was discussed earlier in the session on employment sector. There we have seen that the lockdown has badly hit the workers in the unorganized sector. And we have also seen that in the Indian context, more than 90% of employed women are working in the unorganized sector. And all these unorganized sectors are locked down. These women, several of them, they had no back wages. They have not received the salary of March. They have no salary now. What is the means for livelihood? Especially think about widows, think about single mothers, think about aged women. They were all having some sort of work in the unorganized sector, whether it be the malls or the call centers, special economic zones, or the textile shops. All these are closed. And recently, the lockdown is getting slowly lifted. So a few of them are going back, especially the malls and the textile shops. They're all being opened. But there are numerous, millions of unorganized sectors which are not yet open. And these women, they have lost whatever little they were earning. And I know there are numerous women, they had started small enterprises like beauty parlors, like boutiques, something, and some kind of DTP centers. All these are closed. In the beginning, they used to pay the rent and they used to give 50% salary to their 5 to 10 workers. But now, they have become bankrupt, especially those who started their business in the month of January, February and all. Somehow, they convinced their family members and they started the business. And now, the business is running at a heavy loss because they paid the rent during the month of March, April and May. Now they are closing because they have no money to pay the rent. They have no money to pay the workers. And you know, in the Indian context, women enterprises is comparatively a new phenomenon. It takes so much of a pain for the women to convince family members and start a small business. And now it has ended. And I don't think that these women entrepreneurs, they are going to get another chance in the near future. Even if they are willing, the family members won't let them start it again, unless and until they get interest-free loans from the government to again start up the business. And some of them have lost their confidence. So much of blow to women empowerment. Again, see good number of youngsters throughout the globe, they have lost their jobs. And some of the smart ones, they have started up some online work at home. But still, there are several tragedies in the lives of these people. I will discuss it later. See, the female labor force participation in India was declining over the years. This is a statistics prepared by ILO, the International Labour Organization. And according to them, as per June 1st, 2020, the female labor force participation in India is 21%. And usually we think work from home is the norm for majority of those who have not lost their jobs, especially those belonging to the corporate sector, those in the teaching community, and those who have already lost their work in unorganized sector and have started earning something with some new online work. We have a notion that oh, it is very smooth, very happy, very peaceful, very lovely. But in the case of young mothers, at a time when children got their mothers at home, throughout the time, the children come to the lap of the mother, not on the lap of the father. So the mother has to take care of the baby who has found added attention, added happiness with the mother's lap. The mother has to take care of the baby. See how the baby, the grown-up baby, is asking the mother to go and play with him outside the office. So here what we see, the work pressure upon women who work from home. Even the teachers have to prepare for the online classes. They have to prepare the video lessons. They have to come on live sessions. Everything they have to do. But now what has happened is she has to take care of the added responsibility of the young babies. They want the mother to play, or they want to be with the mother on her lap. There are numerous instances where the young mothers find it extremely difficult to manage the work from home. Think about the condition of migrant women, migrant workers. In the case of Kerala, respectfully, we are calling the migrant workers as guest workers. The instances in Kerala, we cannot generalize it with entire India. We Keralites are different, and about that we will discuss at the end. But now, in the case of these migrant workers in other states, especially in the northern states, lot much of fear of infection, feelings of isolation and loneliness. This is applicable even in the case of our children. Several of the Keralite children, they are stranded up in outside abroad, in different countries abroad and in different states. to pay the rent of the hostel, pay the rent of the paying guest. Crores of them are thrown out. See, where do they stay? They have no place to stay. Wherever they used to stay have been closed. And they have no money to pay the rent. So the only option before several of them was to return to their homes. Several of these Kerala parents, they are sending the money to their children abroad. But what about the worker category, especially migrant women workers? They had no other option but to return back to their home cities. And we have seen the plight of migrant women. While returning homes, walking in the hot sun, thousands of kilometers, their privacy were being badly affected. Several accidents, several injuries. Even the aged parents carrying the little things they had at the workplace, carrying them and carrying the babies. They are walking thousands of kilometers. They had to sleep on open spaces. And some of them had their deliveries on the roadside. And we have read the news, one woman had to walk 150 kilometers to reach a hospital after delivering on the roadside. Roadside deliveries we have heard in Chennai, in Mumbai, in Nagpur, in UP, several places. Roadside deliveries happened. And in this, while sleeping on these roadsides, so much of abduction, kidnapping, rapes, the SRH rights of women, they are getting violated in a way that has never happened before. See, what are SRH rights? Whenever we speak about SRH rights, I think majority of our participants are aware of it, but I would like to call your attention. We will have a quick glance through what are the SRH rights, sexual and reproductive rights. What are sexual rights? If only we understand this, we will come to realize the gravity of violations of SRH rights. Sexual rights are the rights of all persons free of coercion, discrimination, and violence to the highest attainable standard of sexual health, including access to sexual and reproductive health care services, seek, receive, and impart information related to sexuality education, respect for bodily integrity, bodily autonomy, my body, my right. Nobody has the right to touch my body without my permission. Choosing the partner. Decide to be sexually active or not. Whether to have sexual intercourse or not. Consensual marriage. Pursue a satisfying, safe, and pleasurable sexual life. Consensual sexual relations. Decide whether or not and when to have children. All these come under the ambit of sexual rights. Think about the reproductive rights, the right to be informed of and have access to safe, effective, affordable, and acceptable methods of fertility regulation of their choice, and the right of access to healthcare services that will enable women to go safely through pregnancy and childbirth. In this context, think about the asserted rights of women during COVID. What about those migrant women workers sleeping on the roadside? Can we say their rights to bodily integrity was protected? Nothing. They were not at all safe while they were delivering on roadside. It was the responsibility of the state to provide healthcare services for the delivering women. But unfortunately, during COVID period, all the health machinery, the attention were diverted to COVID control. And there were numerous instances where pregnant women were not admitted in hospitals, especially those coming from hotspots or the so-called containment zone. When a woman reaches a hospital seeking admission for delivery, the hospitals deny because you have come from a hotspot, you have come from a containment zone. Even in Kasaragod of Kerala, women had to have their delivery in the vehicle. Numerous instances where the reproductive right of women were violated. And there is a global statistics regarding contraception and abortion. The Foundation of Reproductive Health Services India, which is earlier called as the Mary Stopes International, according to their statistics, in India there is an additional 1 million unsafe abortions. Globally, it is 1.5 million, but in India, it is 1 million unsafe abortions. 6.5 lakh unintended pregnancies, not planned pregnancies. Globally, it is 7 million. 2,600 maternal death. Globally, it is 3,000. You know, in the world, the highest maternal mortality rate among the countries which are assessed, it is in India. And during the COVID period, 2,600 maternal death, either due to lack of reproductive healthcare service or due to the lack of abortion facilities. When I speak about abortion, you may think it is not a good news, a good matter to discuss. But here I would like to think about or read out one of the opinions given by a world famous gynecologist. She says, only women know their bodies best, whether their body is fit enough for another pregnancy, another delivery. Only women know their bodies best, their social situations best, whether I am in a social situation to have one more baby. What is my family health status, my family's economic status, my family's household responsibility status, the nature of my husband's behavior, my in-laws' behavior, everything only the women know. Their lives, what is the nature of their lives. This is known only by individual women. So she says abortion rights are a matter of individual choice and decision making. And you know, several of these women who could not approach the government health facilities, the hospitals for abortions, they have gone for unsafe methods. Likewise, 1 million unsafe abortions have happened in India. Another thing we need to worry about when we speak about women's welfare is the amounting crimes against women. All of you might have heard about the report of some, what you call, the famous Thomson Reuters, the media, the global media agency. In 2019, Thomson Reuters came up and said, India is the most dangerous country in the world for women to live. It is very difficult to believe, but anyway, perhaps it is because in India cases are being reported. We are not sure about the cases going on in Pakistan or Afghanistan. In Iraq, we are not sure, but we are having statistics related to the cases reported in India. And during the COVID time, women have to stay back with the harassers under the same roof. Earlier, when they face domestic violence, when they face sexual harassment, the girls, they used to rush to their school hostel or college hostel. The young women, they used to rush to the paying guest facilities. They used to stay with other friends or relatives. But now, the school hostels are closed, college hostels are closed, paying guest facilities are closed. They have no place to go, rather to come back and share the same roof, live under the same roof with the harasser. The Indian homes, they are no more safe havens to women. No, because in several cases, the home itself is a dangerous place for several women. And while the harasser is around, women cannot even call the helpline. How can they call the helpline? We have the 181 Mitra. We have the Disha helpline. Everything is there. But how can she contact them? Because the harasser, either the husband or the father or the brother, is there scrutinizing, watching what the woman is doing. How can she contact helpline? So helpless, so vulnerable. Frustrations of harassers, especially I remember while there was no liquor facility, the liquor shops were closed one time. So all these frustrations were thrown upon the women in the family. And now, once the liquor shops are open, after getting drunk, again the frustrations are thrown upon women. So whether the liquor shops are closed or open, women have to face violence. And sometimes this violence take the shape of abuse against young children. And these harassers are more confident that they won't be controlled by anyone, because these women are not going to run away. These women are not going to call upon the police. No police or anybody is going to come and question them. So they are more confident to met out more about of violence. The National Commission for Women, the State Commission for Women in Kerala, all of them have come up with the reports of increasing number of child abuse, sexual abuse, and trafficking during lockdown. The UN Women, it has also come up with the increasing, amounting violence against women globally. And see how the young baby is being abused by a father with a liquor bottle in his hand. And what are going to be the implications or repercussions of this abuse in the life of this young baby, young girl? How adolescent girls, they are being abused. How the young girl he used to stay back at the college hostel. But now she has no way out. She is with the abusive father, staying in the same house. Who is going to give her peace and happiness? What all things are happened? What all consequences are going to happen in this young adolescent girl's life? See how the young mother is being abused and how the baby is crying out. The kind of physical attacks, the kind of verbal attacks. These women with nowhere to go, no one to seek help. Definitely, we need to think. Helplines are there. The women's commissions and numerous volunteer organizations, they are ready to help a victim. But how will they come to know about the situation? How could this girl or the wife could call upon this helpline and inform them that she is being harassed? Young children witnessing abuse. That is why we say women empowerment and gender equality has witnessed the greatest setback in history. We were progressing like anything. The women empowerment programs were finding its fruits. It was at that time that the pandemic broke out. The devastating impacts of this catastrophe in the lives of these young children and the women and the mothers and the aged parents, there is no cure. It will take decades to heal the wound. The rise in cybercrimes. There is a spurt in cybercrimes in India with Kerala highest number during the period. The young techno-savvies with their increase now. That is why every other day we are getting messages. Never reveal your bank details, because the people sitting at home, especially techno-savvy youngsters, they are totally engaged in accessing confidential data. TikTok videos encouraging rape and acid attack on women were much viral, especially during the month of March and April. Now, these are all the situations of women in general. But now we need to have an intersectional approach. As I said in the beginning, women are not a homogeneous group. Their lived realities, their daily experiences vary with their age, education, income, employment status, nature of work, class, caste, religion, geographic location, presence of disabilities, whether divorced, whether widowed, whether deserted. Depending upon all these categories, their experiences vary. Challenges of young children, young babies. This is common to male and female, but it has its impact on young mothers. COVID-19 has disrupted the life-saving immunization services, which is likely to affect approximately 80 million children under the age of 1 year. Because these immunity hospitals are focusing upon containment, controlling the pandemic. The young children in the age group of 5 up to 5 years. They find the lockdown as a strategy to confine them, restrict their going out and picnicking with the parents. So what they do? They will ask the young mothers to go with them and play. Don't go for online classes. Come and play with me. They do not know what is happening outside. Their play and fun at school, playground and park is blocked. And who bears the consequence? Who is answerable and accountable to the children? The mothers. Challenges of adolescence. Meeting friends is stopped. The games, picnics, partying, movies, dine out, socialization. In the cafe, restaurant, everything closed. Beauty parlors and gyms closed. And those who enjoyed wide traveling and frequent outing find it extremely difficult to adjust with the present situation. And they become extremely frustrated. And as a consequence, they indulge in all these kinds of abuses, throwing their frustrations on in different forms. And we know in the online classes, there is a great digital divide, which was explained in one of our previous sessions. 33% of women have smartphone facilities, while 72% men enjoy the same. See, there is a digital divide, gender digital divide. In several of our homes, even the younger brother will be having a smartphone, but the elder sister is not having it. The young girls are at the mercy of the father or the brother for her online classes. And we have seen cases where women, the young girls were even willing to commit suicide. In Kerala, we have taken so many measures that is different. But in other states, what will be the situation? See, so much of this kind of difficulties the young girls face. And during the COVID period, lockdown period, once the schools and colleges are closed, once there is no online class facility, where there are no smartphones and all, you know what is going to happen in the future education of young girls? Numerous adolescent girls are likely to drop out from the education system. As a consequence, these dropout girls will be forced into marriage. Dropout and forced marriage. They are threatening future consequences of the lockdown period. The challenges of women in essential services we have already discussed, and here is a picture which shows the challenge of women in essential service, doing everything at home, packing things and going out to the workplace, coming back, taking care of everybody at home. What kind of role conflict? What will be the mental health status of majority of these women in essential services? Of course, we are lighting candles. We are clapping hands for them. But still, they are going through a very tough time. The plight of migrant workers, we have seen. Yeah, this is a picture showing the mother after having delivery on the roadside. Women with cigarette and alcohol dependent family members. The withdrawal symptoms of family member in the beginning, and now after getting drunk, what will be the behavior? There will be higher incidence of violence. Continuous monitoring from the frustrated member with no chance to seek help from outside sources. Now let us see the challenges of elderly women. There are numerous reports of elderly people being more prone to the pandemic because of their decreasing or weaker immunity, because of the existence of other ailments. They are more likely to be hit by the virus. The high death rate among aged people make the condition more complicated. Reports from Italy, we know daily reports. Italy had a huge percentage of aged people and several of them succumbing to death. And these aged people, they have more worries over children's and grandchildren's well-being than others. Their mobility with regard to morning and evening walks, it is restricted. Even their visits to the hospitals for routine checkups, it is also restricted during lockdown. And another thing is, numerous reports show that the elderly people, they face so much of alienation. The other family members are not interested to talk to them. They have nothing to share with the aged parents. These parents totally confined within the home with nobody to share their feelings and with no facilities to go for routine checkups. Even the youngsters are so scared about infection. And when these aged parents hear all these reports from foreign countries about the high rate of mortality among aged, what will be their situation, their anxiety? And there are some people who are the most vulnerable. The young women entrepreneurs, I discussed it earlier, the domestic helpers. We have all asked our domestic helpers, no need to come, you stay back. In the early days, we used to give them salary. But what about now? Are they getting regular salary? What about the sexual minorities, the transgenders? These sexual minorities are people who are already kept away, abandoned by their own family people. And now, majority of them who used to live as sex workers or in the beauty, employed in the beauty industry, they have no place to go. Others have a place, the home. What about these people? They are already thrown out. And several of them are not in a position to seek medical help. So these kind of problems, vulnerable people, the transgenders. What about the condition of sex workers? Yesterday I was attending a webinar where it was said that the sex workers in UP and Delhi, they work for 7 rupees and 8 rupees for an hour. So pathetic situation. What is the condition of women with disabilities? They are triple vulnerable. All those homes which used to take care of people with disabilities, they are closed. Physically challenged, mentally challenged. Several of them were taken care of in homes, special homes. But now these special care homes are closed and they have come back to the home. And the people at the home, within the family, they are not skilled enough to take care of these people. And other people with disabilities, they cannot move out. They are more prone to sexual abuse. We need to think about all these people when we discuss women's welfare. Again, women living in urban slums, We are fortunate enough to keep the physical distancing. What about people living in urban slums, as we have seen in Maharashtra, Mumbai? They have no space to keep the distance. There also, when more number of people, all of them get confined and frustrated within the small rooms, the chances of abuse, especially sexual abuse, the chances of infection, everything is much more higher. So far, we were thinking about all the negative feelings, experiences we are having during lockdown. Let us think about certain positive experiences. All of you are familiar with this picture. The national leaders of Germany and New Zealand shaking hands. All of us have heard about how the nations with women leaders, women heads, Germany, New Zealand, Taiwan, Denmark, and our small Kerala, with our Shailaja teacher. So much of reports and applause are happening in social media regarding how they could contain this disease and flatter the curve. In Kerala, definitely the curve is increasing, it is hiking. Just because we have been so happy to receive our people living abroad, our people staying abroad. Otherwise, we would have been so noted, so applauded for the success. So, women leaders are in a better position to manage this pandemic. This is a proof of women power. And you might have read this particular case of this IAS officer. This IAS officer from Visakhapatnam, Andhra Pradesh, she joined back her work on the 22nd day of her delivery. See the commitment, how dedicated the women are to their work. India has witnessed the dedication and the commitment, responsibility of women, especially with the 33% reservation in Panchayati Raj institutions. Yes, once we are given opportunities, we know how to manage things. Why I said this is, once given opportunities, one more thing, our Kudumbasri mission in Kerala, the infrastructure that Kerala possesses, that is a great asset with which Kerala managed its fight against the pandemic. 1144 community kitchens, the good number of NREGA, the kind of masks and sanitizers prepared by Kudumbasri, the takeaway food counters organized by them. And I know all of you know how the community kitchens provide food to all those people, all the patients, all the susceptible persons, suspected people within hospitals, in quarantine, all the frontline workers, for every one of them, food is provided. Who are cooking it? The women Kudumbasri members. And lot much of grocery kits, takeaway food counters, where the food is given for even 20 rupees per meal. Safe food. Who prepare? The Kudumbasri people. The grocery kits prepared by Kudumbasri. And they also call the elderly every other day and speak to them after understanding how these elderly women are becoming alienated. We have the Sannadha Sena portal of the Kudumbasri. They are ready to assist the government, the state government. What is required? We are there. We are there. And the awareness generation done by the Kudumbasri, the 44 lakh women in our Kudumbasri all set to fight the pandemic, support the government, and do wonderful things. That is women power. So I have given you 3 instances of women power. In our way forward, we need to bear in mind this women power. Whenever these policies are framed, because we need to frame numerous policies in the future, in the immediate future. There, whenever we frame policies, it must be done with gender perspective. We must include women from all these walks of life while we formulate policies. We in India have the Food Security Act passed in 2013, whereby we have a very strong public distribution system, our ration system, through which we provide the food grains, the ration, the subsidized food grains, everything we are providing. Yes, it is there. And this food security system must definitely include all those without a ration card, all those without an Aadhaar card, all these people, even when they are not Indians. Everybody, we must have an inclusive policy, include everybody in our food security policies. We must pay special attention to young children. No one should be undernourished. Though we are providing this kind of food security, what is the nature of nourishment, special nourishment provided to young children? All the ASHA workers, all the ICDS people, they are all frontline workers focusing on COVID-19. So the nourishment, the nutritional supplies, they are all blocked. In some places, they are being carried out, but there are numerous places in India where all these nutrition supplies are temporarily stopped. So we need to special attention to young children while we formulate our policies. And the scaling up of NREGA, the Rural Employment Guarantee Program, we need to increase the number of days from 100 to 150. We need to increase the pay to 250. These are all means whereby the lakhs, millions and millions of women in India, they could find a livelihood. Of course, cash transfers are there. The cash transfers through Pradhan Mantri Jan Dhan Yojana and all. What about people without Aadhaar card or without a bank account, without a ration card? What will happen to them? What is the loan facility for them? So cash transfers must be there for those without. And I won't recommend the cash transfer to men, but for women, the young mothers, the widowed, the deserted, the aged, the divorced. They must get cash transfer wherever in India. At least a 500 rupee per month, free cash transfer. And it is easy to locate them because we have such a wonderful network of ICDS, ASHA supervisors. So these people could know who is there, where they are. And we could supply the cash transfer through them. Interest-free loans to women students to purchase smartphones. Interest-free loans for entrepreneurs, women entrepreneurs, to revive their small enterprises. The Kudumbasri model is something that could be adopted by the entire India and the entire globe. Recently, I published an international book, and through the book, I urged the whole globe to follow our Kudumbashree model. And a beautiful chapter of 22 pages regarding our Kudumbashree details was included in the book. And I want the whole globe to follow the Kudumbashree model. And finally, we need to break the chain of gender division of labor. Why all our women become sick? Why our women become so tired and exhausted? It is all because of gender division of labor, which means somehow over the centuries, we are passing on a tradition that all the housework and all the care work should be a woman's responsibility. No. Anybody can do all this work. Children is the collective responsibility of both the parents. The work in our homes is the work of everybody. And I urge all mothers, especially in the Indian society, to take this as an opportunity where you should train your husband and your children to share the responsibility of all the household work. Plan it in the day, morning. Who is going to wash? Who is going to mop? And who is going to cook? Every work should be shared. This will do wonders in the lives of the children and in the lives of the mothers and also the husbands. Why our men, they resort to all these kind of drugs or liquor or smoking? They have nothing to do when they are locked up home. They are not trained to do household work. So take this as a challenge, my friends, women friends. Train them. And our youngsters, we don't know where our youngsters are going to study in the future, work in the future. So instead of giving them online classes on cooking while they live abroad, give them classes, first-hand experiences now itself. I know thousands of women in India, in Kerala, who provide online classes to their boys especially, and also girls in some cases, how to cook food. Because they are abroad, they don't know how to cook. Instead of that, why don't you give them first-hand training during the lockdown period? You will be relieved of all this exhausted, tiresome work. To the young adolescents, I have a request. You are the cheer girls and cheer boys of families. You talk to mothers, talk to fathers. You entertain your parents, your grandparents. Because several grandparents tell me, my grandson, once he calls me, I feel so elevated with his sound, so excited with his sound. Why don't you speak to them? And the youngsters say, we have nothing to share with them. Simply share any jokes. Simply share your experiences as a small kid. Simply share how you love them. And your small voice for 1 minute will do wonders in making these aged people happy. So let us all together make a difference in the lives of all of us, and let us fight together. Let us stay positive, stay safe and healthy. Thank you.
Okay. Thank you, ma'am, for your wonderful session. Then it is the time of discussion. I invite the persons who use questions or doubts, the interactive session.
Let me see the chat box.
Sending thanks.
Only thanks
Yeah.
are there, no questions. Only no questions. Questions are not there. I think most of us are quite familiar with whatever I discussed because there have been numerous webinars, n number of webinars. Every other day we are listening to resource persons and discussing all these things. So all are very clear about whatever I have discussed.
There is one question is by Shafira. This question.
How to reduce gender discrimination. That itself is a webinar. How to reduce gender discrimination is a great webinar session. Where should we begin? Who should take the responsibility? Gender discrimination, it is deep rooted in our culture. So, in order to reduce it, all of us, all families, all social institutions, the school, the media, the religion, all of us join hands. And how to reduce it? Treat our boys and girls equally. During the socialization, there should not be any discrimination. We shouldn't place so much of don'ts. Don't do that, don't do that. So much of don'ts on girls. If there are don'ts, all these don'ts must be equally applicable to boys and girls. All the do's must be equally applicable to boys and girls. So, while I was making some of these foreign trips to America, Canada, Denmark, and all, I have never seen any kind of gender discrimination. And I could enjoy the respect the men showed to the women. And I used to discuss with the professors there. You don't have any women's studies or gender studies programs in your schools or colleges. Whatever you have are only PhD programs. In very few universities, there are gender studies programs. Then how come this much of egalitarian relations in your country? You know what the professors told me? They said, all the lessons of egalitarian relations, our children learn from the family itself. What about the children of Kerala or India? Though we have a prestigious culture, what is the nature of egalitarian men-women relations, especially husband-wife relation? In our families, though the wife and husbands were good friends before marriage, self-choice marriage, the moment they get married, the relationships undergo a slight change. We can see numerous families where the mothers or the wife openly respect the husband or the father. But in how many families we can see a father or a husband openly respecting the mother? Very few families. So in one slideshow, I showed how the mother is struggling with work and the father is leisurely lying down. Say the children who see this kind of discrimination in household work, when they grow up, the cycle will repeat. When the children grow up, the baby girl, she will do all the household chores. And the young boy, when he becomes a husband and father, he will lie down and enjoy. So this kind of cultural transmission is happening. And who is going to bring about a change? All of us together. Together, let us make a difference. How can we solve the problem of digital divide with respect to gender? There also, there is a kind of transmission of a kind of culture, a cultural transmission, that men and boys, they are good at science, maths, technology. Women are not good at science, maths, and technology. The young girl grows up in a family or in an educational system where such a message is already existing. Women most often have a kind of technophobia, an aversion to technology. Even if we have to change a fused bulb, electric bulb at home, who does that? The young girls see that the father does that. The young boy sees that. So we think even the simplest technology of changing an electric bulb, it is considered as a man's job. I want our young girls to be so smart, break the stereotypes, break all stereotypes, and you can do whatever work is done by a boy or a man. Try to do it, break the stereotype. And parents should encourage girls. And regarding the digital divide with regard to smartphones and all, I want all parents to feel convinced that your daughters know how to safeguard them. If you don't know, you need to take help how to ensure safety and security of youngsters in the social media network. How to keep oneself safe from the cyber crimes. We can have another webinar on that. Give them smartphones. Train them how to use it judiciously. Parents must buy it. Where parents fail, let the college or the service organizations do it. Where all these people fail, let the government do it. Provide the girls with smartphones. What is wrong in it? So the parents, they are least convinced. How dare you say that? There are numerous cases where girls are being trapped in cyber crimes, trapped in the, what you call, social media. Why are you so scared? Train them, teach them, tell them how to ensure their safety. എലിയെ പേടിച്ച് ഇല്ലം ചുടുക അതല്ല വേണ്ടത്. We need to help them. We need to teach them. We need to train them. So thereby, we can minimize the digital divide. And we must enroll more girls into courses of science, technology, and this kind of what you call maths. Such streams, we must enroll more of our girls. Is there any role played by schools and colleges to create gender identity construction? Definitely, 100%. Whatever role a family has, equal role is there for schools and colleges. And that itself is another topic for 1 hour discussion. The schools and colleges, they are supposed to develop egalitarian relations. They are supposed to work for gender equality, facilitate the women empowerment. All these are responsibilities of schools and colleges. But unfortunately, all our schools and colleges are entrenched with the gender bias, different forms of bias. One of my scholars conducted a PhD work on the school climate of Kerala. 24 schools studied. You know, in schools, except in government schools, there are separate exit and entry. Girls and boys treated as two different species. They are not permitted to mingle or speak. They are not permitted to sit together. And even the teachers, we had a discussion with the teachers. And do you know what the teachers say? Girls are girls, women are women. Women are only women. What you speak about as gender equality, it's an utopian idea. Such teachers are molding up the upcoming generations. Our younger boys and girls are trained by teachers who believe gender equality is an utopian idea. Girls are only girls. Women are only women. And that is why the UGC, the University Grants Commission, has directed all colleges and all universities to conduct 1 month long gender sensitization program during COVID period, lockdown period. The UGC didn't say you conduct 1 month nanoscience program or digital technology program. No. What is most important is gender sensitization program. We need to sensitize all teachers, all students, boys and girls. Whenever I speak about gender equality, I never mean it is something that is to be brought about a change in men's attitudes. No, we need to bring about changes in the attitudes of all men and all women. It is not a responsibility of women. It's a collective responsibility of all men and all women. So schools and colleges have a role. First, they need to eliminate their own bias. And then we need to train the teachers. And then the teachers will bring out the so-called people who believe in gender equality, who believe in feminism, who believe in women empowerment. Okay.
Hello, ma'am. Time is over. It is near to 5. You can conclude.
ഗുഡ് ഈവനിങ് മാഡം, ഞാനൊരു സംശയം ചോദിച്ചായിരുന്നു.
Okay, okay. Are you Mohanan
അതില്
Getty?
അതെ.
Okay, okay.
അത് ചെലവിന് കൊടുക്കാതെ ജയിലിൽ കിടക്കുന്ന ആളുകളുണ്ട്. അവരുടെ കുട്ടികള് നിരപരാധികളാണ്. ഭരണഘടനാപരമായിട്ട് അവർക്ക് ജീവിക്കാനുള്ള അവകാശം കൊടുക്കേണ്ടത് നമ്മുടെ സമൂഹത്തിന്, സർക്കാരിനല്ലേ. ഒരു ഗത്യന്തരമില്ലാതെ ആ കുട്ടികൾക്ക് പഠിക്കാനോ മറ്റുള്ള ജീവിത സാഹചര്യം ഇല്ലാത്തൊരു സാഹചര്യമാകുമ്പോൾ അത്തരം കാര്യങ്ങളിൽ നമ്മുടെ സംഘടനകളോ അല്ലെങ്കിൽ സർക്കാരോ എന്താണ് നിലപാട്, അതിനെക്കുറിച്ച് നമുക്ക് എന്താണ് പറയാൻ പറ്റുക എന്നുള്ളതാണ് എൻ്റെ ഒരു സംശയം.
The mom is disconnected, I think. Wait.
ജയിൽ
Just എന്തെങ്കിലും just yes. Hello. I think she is not connected. Or hello, ma'am. Sir, she is not. Yes, yes. Ma'am, it is not audible. Your mic is off. Not audible. Okay.
Okay.
Okay. Okay.
Can you please read out the query?
Yes, yes.
Bushra, can you read out the query? What is
ചെലവിന്
the,
നൽകാത്തതിന് ജയിലിൽ കഴിയുന്നവരുടെ നിരപരാധിയായ കുട്ടികളുടെ അവകാശങ്ങൾ സംരക്ഷിക്കും.
yeah.
വളരെ കുറഞ്ഞ വേർഡ്സിൽ ഒന്ന് പറഞ്ഞു കൊടുത്താണ് സാർ.
ആദ്യം ഈ കുട്ടികളുടെ ചെലവിന് നൽകേണ്ട ഉത്തരവാദിത്വം ഈ ജയിലിൽ കഴിയുന്ന മനുഷ്യന്റെ തന്നെയായിരുന്നു. ഇനി അയാൾക്ക് പറ്റാത്തത് കൊണ്ടായിരിക്കാം അയാൾ ജയിലിൽ കഴിയുന്നത്. തീർച്ചയായിട്ടും ആ കുട്ടികളുടെ അമ്മ വീട്ടിലുണ്ട്. ആ കുട്ടികളുടെ ഉത്തരവാദിത്വം അമ്മയുടെ ഉത്തരവാദിത്വമായി മാറിയിരിക്കുന്നു. And it is also the responsibility of the society. You need not worry about such people because we have a collective responsibility. Also, the public distribution system is there. The Kudumbasri system is there. Definitely, the mother of the family will be a member of the Kudumbasri. And we feel much happy that the Kudumbasri won't let any family to starve. And our Food Security Act will not let any family to starve. അതുകൊണ്ട് നിങ്ങൾ വിഷമിക്കേണ്ട ആവശ്യമില്ല. ആ ഫാദർ എത്രയും പെട്ടെന്ന് പുറത്തു വന്ന് അയാളുടെ ഉത്തരവാദിത്വം മനസ്സിലാക്കട്ടെ. ഇപ്പൊ ഇവിടെ ഇതിൽ പാർട്ടിസിപ്പേറ്റ് ചെയ്യുന്ന 105 പേര് ഇപ്പോൾ ഉണ്ട്. ഓരോ ആൺകുട്ടിയും ഓരോ പെൺകുട്ടിയും മനസ്സിലാക്കേണ്ട ഒരു കാര്യമുണ്ട് ഇതിൽ നിന്ന്. എന്തുകൊണ്ടാണ് ഈ ഹസ്ബൻഡിന് ഉത്തരവാദിത്വം ഏൽക്കേണ്ട വന്നത്? വൈഫിനെ പഠിപ്പിച്ചിട്ടില്ല, വൈഫിനെ ജോലിക്ക് വിട്ടിട്ടില്ല. ഇതൊന്നും ഇല്ലാത്തത് കൊണ്ടല്ലേ ഹസ്ബൻഡ് ഉത്തരവാദിയായത്? അത് നിറവേറ്റാൻ പറ്റാത്തത് കൊണ്ടല്ലേ അയാൾ ജയിലിൽ പോയത്? സോ ഇൻ ദ ഫ്യൂച്ചർ there should not be any such instances where the man only should be responsible for taking care of children or feeding the children. It should be the collective responsibility of husband and wife. ഭാര്യയും ഭർത്താവും ജോലിക്ക് പോകണം, അവനവനെ കൊണ്ട് പറ്റുന്നത് ചെയ്യണം, കുട്ടികളെ പഠിപ്പിക്കണം, പെട്ടെന്ന് കെട്ടിച്ചു വിടരുത്. എത്രയും പെട്ടെന്ന് we have a kind of what is called tradition where young girls are married off at the earliest. We should stop it. Let them study. Let them become employable. Let them get an opportunity to work. And then let us think about marriage. If only the girl is willing. In that case, even if the husband is not in a position to take care of the responsibility of feeding the children, the mother is there. Let it be collective responsibility. ഇനിയെങ്കിലും നമ്മൾ അതിനെപ്പറ്റി ചിന്തിക്കണം. Collective responsibility of the family. Okay.
Ma'am?
Madam, I have a question.
Yes. Yes.
Actually, yes, sir. Okay, thank you. I am Abdul Majid here. Actually, I am working in Abu Dhabi. So
great.
I am a,
Are you back home now? Are you back in Kerala now?
No, I am no. I am on work only. It's in I am in Abu Dhabi only.
Yeah. Okay.
My family also was there. As of now, they are in Kerala. Okay. We both are working class family. We have 2 children, one boy and girl. So I think almost all your aspects, you are a fully empowered woman. Am I correct?
Yes.
Yes. In your sensible talking, it is fully implemented in your family. Am I correct?
Yeah.
Yeah. So my simple question is that in your department, how many girls and boys students is there? Majority of students is boys or girls?
Girls.
Girls.
Majority are girls.
Yeah.
But
very
there
good.
are almost 25% boys.
Yeah. Let me conclude, madam. And in my belief, in Ponnani MES college also, almost 80 to 85% of girl students. So where is this discrimination of education? മാഡം ഇപ്പം നെക്സ്റ്റ് തൊട്ട് മുമ്പത്തെ ക്വസ്റ്റ്യൻ ഒരു ആൻസർ കൊടുത്തു, പെൺകുട്ടികളെ പഠിപ്പിക്കുന്നില്ല, പെൺകുട്ടികൾക്ക് എംപവർമെന്റ് കൊടുക്കുന്നില്ല. ത്രൂ ഔട്ട് യുവർ ക്ലാസ് I feel it. This is not a empowerment of woman. It is actually you are establishing a feminism into listening student. Am I correct or not? ഇതൊരു ആർഗ്യുമെന്റ് അല്ല, ആക്ച്വലി എനിക്ക് വന്ന ഒരു തോട്ട് ഞാൻ ഷെയർ ചെയ്തു.
Thank you very much. I take it as a very positive question. Okay, thank you so much. നമ്മുടെ സമയത്തിന്റെ പരിധി മാത്രമേ ഇവിടെ ഉള്ളൂ. അല്ലെങ്കിൽ see, why do we send our girls to the colleges? Question number 1, we need to think, what is the objective of sending girls to colleges? How many of the parents want their children to get employed before getting married? The next question, how many of our parents are ready to invest in an enterprise started by their daughters? What is our attitude towards the breadwinner of the family? As part of our culture, we think the boys, the men are the breadwinners. We send our girls to the colleges not to get them educated, make them employable, and ensure their safety through unemployment. That is the first answer. Wherever a good alliance comes, immediately the girl is married off. And once married off, what happens? We know. The family building, children, raising them, and then coming back. See? So the several studies we have conducted, research. The research shows that the attitude towards higher education of girls in Ponnani, in Malappuram district, is still not so progressive. There are exceptional cases. Maybe 5 to 8% of parents in Ponnani or in Malappuram or in this particular area, where northern Kerala, who are sending their daughters to colleges to get them educated, empowered, employable, and to see that they are employed before getting married. More than 92%, they simply send their work to daughters. They have no aspirations, career aspirations. They don't have it. They don't have it. Then how come the girls get empowered? They are simply sent to schools, colleges, or to the universities. And you know what is the dropout rate? How many of them are getting married and dropped out? If they get a good alliance, immediately she will be married. So what is the objective of higher education? And you also said about, and I want to give you a very good clarification, that more than 85% of students in all the higher education institutions in Kerala are girls. In all the departments, the 33 departments of Calicut University, more than 85% are girls. In some of the departments, there are only 1 boy or 2 boys. There are classes like that. Where are the boys? Where are the boys? Nasamuddin sir, can you please mute your phone? Nasamuddin sir, yeah. Where are the boys gone? A good number of them, they have gone to prestigious higher education institutions to complete their, the high-paid courses, whether it be engineering, or it be medicine, or it be MBA, or it be some kind of CA, or something like that. They have gone for those courses in the prestigious professional colleges, either in Kerala or outside Kerala. You take a statistics of the Indian students studying abroad. More than 90% are boys. So we simply say, to credit all the students in colleges or arts and science colleges, degree colleges, or PG colleges, and all the students in university departments are girls. But where are the boys? Think about it. And I would like to add a comment on feminism. I am a feminist. I am a person who believes in God. And my God, my conception about God might be different, but still, I think feminism is a divine concept, a very divine concept, which believes in the equal creation of men and women by the great God. Both are equally capable. Both have equal capacities. Both men and women must be given equal opportunities to grow up. Let both of them together share responsibilities. We need to nurture them equally. Give them equal opportunities. Why should we deny so much of the privileges to girls and grant boys so much of positive privileges? So, the do's and don'ts in bringing up children must be same for boys and girls, so that our girls will grow up as smart ones, smart, young, talented girls. The parental mindsets should change. Okay, yeah. So it is getting.
Okay, ma'am. Thank you. Okay, it was very informative. And
Thank you very much, madam.
the
Thank you very
time
much,
is
madam.
over.
ആക്ച്വലി ഇപ്പൊ ഇതൊക്കെ കേട്ട് കഴിഞ്ഞപ്പോ എനിക്ക് പറയാനുള്ളത് വളരെ സിമ്പിൾ ആയിട്ടുള്ള ഒരു കാര്യമാണ്. ഇത് പാരന്റൽ വുമണിന്റെ പ്രോബ്ലം ആണ്. ഈ ബോയ്സിന് കൂടുതൽ സൗകര്യങ്ങളും കൂടുതൽ ഡൂസും ഗേൾസിന് കൂടുതൽ ഡുനോട്ട്സും നൽകുന്നത് ആക്ച്വലി മദറിന്റെ ഭാഗത്തുനിന്നാണ് കൂടുതലായിട്ടും ഉണ്ടാവുന്നത് എന്നൊരു കൂട്ടിച്ചേർക്കൽ കൂടി എനിക്ക് അതിലുണ്ട്. ഓക്കെ, താങ്ക് യു വെരി മച്ച്.
I have one more thing to add. Yes, we have a cultural tradition that mothers are the caregivers, or the responsibility of nurturing children.
And why they are giving more care to boys than girls?
We are not giving care. We are giving privileges, and we are giving so much of don'ts to girls and do's to boys.
So it is coming from women only, not from.
Why not? Where are the fathers? Where are the fathers?
Yeah, that's my question.
Yeah, the fathers shouldn't deny their responsibility. അവരുടെ റെസ്പോൺസിബിലിറ്റി ഈക്വലി ഉണ്ട്. മദറിനോട് പറയാലോ, അങ്ങനെ വേണ്ട, ഒത്തിരി ഡോൺസ് ഒന്നും എന്റെ മോളുടെ മേൽ വേണ്ട.
നമുക്ക് കാണുന്നത്.
അതിന്റെ കാരണം എന്താണ്? ട്രഡീഷൻ. So we need to change, break the tradition, break the chain, not only of corona, but also of,
Anyway, thank you very much. I am not in a arguing mood. Okay, thank you very much.
Yeah, I know you are thinking very positively.
Okay, ma'am. We can conclude. It was very informative and eye-opening session. You pointed out that women are only not the woman; they are the half of the humanity or half of the earth. And now I am invite Ms. Najia for the vote of thanks.
Can you hear me?
Yeah, we can hear you.
First of all, good afternoon, ma'am, and thank you for the valuable session. Respected and our most distinguished chief guest of the day, Dr. Molly Kurumila, our beloved HOD, Bushra Miss, our Secretary, Miss Ponnani College, Abdul Rashid sir, and honorable professors, I deem a great honor to propose the word of thanks to all who have helped us in the making the webinar such a resounding success. I would like to thank our distinguished speaker, Ms. Dr. Molly Kuruvilla ma'am, for making excellent presentation and working this webinar interesting and meaningful. I would like to thank our HOD and all the staff members of Department of Economics who have made the webinar great success. And also I would like to thank from my heart for the great participation of the people who have gathered today on this webinar series. On the behalf of KEIZAI 2020, once again, thanks to all by in the name of the team. Thank you all. Thank you very much.
Okay, thank you, ma'am.